Hi, this is Dr. Geetha Reddy, IVF specialist from Amrutha Fertility Center, Karimnagar. Now I am going to tell the causes of female infertility. So usually the infertility may be due to the male partner, due to female partner, or sometimes the causes may be in both, and sometimes there is no cause found on general investigations. So it's like this, about 30% of the causes are in females, 30% of the causes are in males, about 30 in both of them together, and about 15 to 20% it may be unexplained, like we don't get a cause, we don't see a cause for the infertility in that particular couple. So now I am going to discuss about causes in female infertility. Before that, I would like to explain about the reproductive system here in brief, the structure of the uterus. This is the uterus, this is the vagina, and these two are the fallopian tubes, and these two are the ovaries. So normally when a female has regular periods, she will be ovulating around between 13th to 16th day. Then ovulation means a release of egg from the ovary, and that ovum is that ovum, we call it egg or ovum. Ovum is picked up by the tube and it sucks the ovum into the tube. So after intercourse, there are millions of sperms, and one sperm reaches here and fertilizes the ovum, and the embryo is formed here, and the embryo travels all the way from the tube and gets implanted in the uterus. So this is normal fertilization. And here the uterus has three layers. One very thin layer is the serosal layer, the middle one is the muscular layer, and the inner part, which is very important for implantation of the embryo and growth of the baby, that is endometrium. Most of the causes for female infertility lies in these ovaries. So either the patient must be having polycystic ovaries, like they have irregular periods, they have acne, hirsutism, like abnormal hair growth on the face, on the whole of the body. In ovary, they have either polycystic ovaries, or the ovary fail very soon, even before 35 years. So that's called premature ovarian failure. In all such cases, they have irregular cycles. And next is the tube. Sometimes there are infections, so the tube is blocked, or the tubo-ovarian relationship is very important, which is not maintained in some cases, like when they have intraperitoneal infection or uterine infection or tubular infection. There are adhesions, thin flimsy structures that tighten the reproductive organs. Somehow the tubes are blocked either with bacterial infections or tuberculosis, and the tubo-ovarian relationship is not maintained. There are certain problems in the uterus like fibroids. When the fibroids are within the endometrial cavity or in the myometrium pressing on the endometrium, or when there are some small fleshy structures, these are called endometrial polyps, which are seen inside the endometrium. Or sometimes they are born with uterine abnormalities, like they have a septum, it's like a wall like thing, muscular wall or fibrous wall within the uterine cavity. Or sometimes the cervix is tightly closed and it doesn't allow the sperms to enter inside. So in all such cases, these are the structural causes. And sometimes there are hormonal defects, like there is abnormality of thyroid hormone, either the hormone is more or less secreted, or other reproductive hormones like FSH, LH, which act in the process of ovulation. So there is a hormonal imbalance in such cases, or the testosterone is more. Sometimes when the ovaries fail, it's AMH. AMH, anti-Mullerian hormone, is less secreted. In all such hormonal imbalance or infections or ovulatory disorders or uterine causes, In all such cases, the pregnancy is delayed since the technology is more and the investigations are very good, and even the lab investigations have come to rural level, and high resolution ultrasound machines are there. We have treatments for several of these cases once they are evaluated so that they can conceive earlier. Thank you.